You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Lori Cesario, owner of Canine Cancer Academy, and we're going to talk about how important cancer detection is for your pet. Welcome, Lori.
Hi, nice to be here. I really appreciate you inviting me.
Oh yeah, thanks for being on the podcast. So tell us about Canine Cancer Academy.
All right, so I am a board-certified veterinary oncologist, and the Canine Cancer Academy is actually an online company that I started that provides educational resources that focus on canine cancer. So helping dog owners get the information they need after a dog cancer diagnosis.
And so a person, let's say, so we just lost our dog, a pug, to cancer. And so once I had received the diagnosis, I would go on, what is the online?
So the website is caninecanceracademy.com. And I have over 60 articles on there that people can access. I also have a canine cancer program called the Dog Cancer Roadmap. That's basically an A to Z guide from anything that I think a dog owner should know, from like, how do we make a diagnosis? How do we make sure we have an accurate diagnosis? What do all of the tests mean? What are different common types of cancer? How do we make sure that dogs have an excellent quality of life? Everything that you would need to know. And something like that also includes every other week office hours where you can ask me questions. So there's sort of something for everyone there, including a link to my podcast as well.
Oh, that's exciting. So like if you, let's say, so Chuck the pug, he had lung cancer. And so then I would go on the site, and is it fee-based, or is part of it fee-based, part of it free?
Yeah, exactly. So access to all of the articles, over 60 articles, all of that is free. People can sign up for my email list and get like a new article as well as a link to the podcast every week if they'd like. And then the only thing that's fee-based is access to that canine cancer program, as well as the every other week office hours with me. So there's kind of something for everyone there.
Well, I think having the online and talking to a vet that's a phenomenal idea. I mean, it's really needed, I think, in this space, because a lot of dog owners are very intelligent and well educated on how to take care of their pet, and they just need a little advice. So I commend you on that.
Yeah, I'm glad I'm able to offer it.
And so what can pet owners do to be proactive?
If we talk about like early detection, that sort of thing, I would say the best possible thing is, if you notice a new mass on your dog, just have your vet get a diagnosis. So the distinction is that you always want to ask your vet to sample it you don't want to ask your vet to look at it, because the issue is that there are many types of cancerous tumors that will look and feel benign. So if somebody asks me just to take a look at a mass, I might say, well, it looks benign, but the only way that I can say for sure that it's not a type of cancerous tumor is actually to take a sample. So you always want to try and get a diagnosis, and even benign tumors will continue to grow. So our best chance of giving your dog an excellent outcome, being able to get to the tumor while it's still small before it has the opportunity to spread or get too large for surgery, is when you first notice it. And you can just get in the habit of maybe doing like a full body head to toe dog massage, where you're just kind of feeling for new lumps and bumps, feeling for anything that's changed. Make sure that you look in your dog's mouth, under his tongue, feel his neck. Just be nice and thorough. And if you do that on a regular basis, you should get a really good idea about what is new and what's not new.
Okay. And so that would be proactive. And then to go into your local vet. And then after that, you can help guide individuals on the best practices for their dog.
Yeah. And the kind of in line with being proactive, if you notice that your dog starts limping or develops a new behavior, like, isn't really wanting to eat as much or seems a little bit lethargic, most of these things are going to go away and not be a big deal. But, if you notice that something's just not right and, it's not getting better, I would just alert your vet, have your vet do a physical exam. And if they can't figure out what's going on and if it's getting worse and not getting better, just make sure that you kind of get to the bottom of things one way or another. Either that's with tests through your regular vet, or if they can't find an answer, then that might be time to see a specialist like an internal medicine doctor or an oncologist, just to get to the bottom of things.
Okay. And tell us about your podcast.
Oh, yeah. My podcast is called Your Dog Wants You to Know This, and it's a weekly podcast. And every week I interview a different veterinary expert from a different field. So some of it's oncology related. Some of it is talking to surgeons about, pain relief and quality of life. I just interviewed a veterinary behaviorist about anxiety and aggression. I interviewed a veterinary dentist. So trying to bring people the latest in veterinary medicine so they know what's possible and what's coming in the near future.
Oh, neat. And so how do people get a hold of you?
I would say the best way is through the website. There's an email on the website. And again, the website is caninecanceracademy.com. And there's a ton of information there. Like we mentioned before, links to the podcast, and they could sign up for my email list, and they get like weekly articles and weekly links to the podcast. So that's the best part. I'm also on Instagram and Facebook too.
Oh, great. Well, I certainly appreciate you being on the podcast, and I would love to have you back.
Excellent. Thank you so much. It was very nice to be here.
Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.